Hello everyone, it's Sophie here. Some of you will recognise me as your hygienist, so hello. If you don't recognise me, then I should probably introduce myself a little bit further. As I said, my name is Sophie and I'm the hygienist therapist at North Street Dental and Implant Clinic in Dudley. And I thought that today I would share with you my top 3 tips for taking care of your teeth during this isolation period. These tips aren't just useful during isolation, they're useful all the time, but now is a good time to be letting you know because we cannot currently be providing routine dental treatment. It is emergency treatment only, so that means the care of your mouth is all in your hands. So I'm going to be giving you my top 3 tips on how you can be doing a good job at home with looking after your teeth. So the first tip is to make sure that you are brushing your teeth twice a day for 2 minutes. A recent survey showed that only 60% of adults brush their teeth twice a day, which I thought was pretty low. And now we've all got plenty of time on our hands. There should be no excuse really, should there? But we've got 2 options for brushing our teeth with. We've got electric toothbrushes, which look a little bit like this, and manual toothbrushes that look like this, and both of these should be used for 2 minutes morning and evening. The reason why we say twice a day is because an evening brush will clean away any of the plaque and bacteria and food that's built up after being eaten and drinking throughout the day, and then a morning brush will clean any of the bacteria that's built up overnight, and that will often result in morning breath. So keeping your teeth brushed twice a day will just keep everything feeling clean and fresh. The second tip is to be using something between the teeth, and again we've got a couple of options for this, and the reason why we say to be cleaning between your teeth is because that even though the adverts tell us that they do, toothbrushes don't get all the way between the teeth, and it's often those areas that cause things like inflammation and bleeding because they're not cleaned out thoroughly enough. So there's a couple of options for cleaning between your teeth. The first is something like floss. This one here is a tape floss, and I think that this one is a little bit more forgiving than thread floss, and that's because it's a little bit more gentle if you do slip. That's just to be used between the teeth and trying to get it all the way to the back as well. The second option is something like an interdental brush or a pick, which look a little bit like this. This is a pick. You might have seen the interdental brushes, and they're just used in between to just push through to make sure that there's no food or bacteria between the teeth, and that should be done every day. And the survey also said that only 27% of adults actually use interdental cleaning, so why not use this isolation period to become one of the people that actually do brush twice a day and do use something between the teeth. And my third tip is to use a toothpaste with fluoride in. Fluoride is a naturally occurring mineral which strengthens the outer layer of the teeth known as enamel. And enamel is normally where caries or decay of the teeth occurs, and if it goes further than that, it can result in needing a filling. So using fluoride regularly can help strengthen that enamel to protect against the need for fillings. And to check that your toothpaste has fluoride in, you just want to look on the back of the label, and there will be some information you can see there in brackets that's followed by ppm, and that means parts per million. So it's basically telling you how many parts per million of fluoride there is in your toothpaste. So that's just an easy way to check that you've got fluoride in your toothpaste. So those are my top 3 tips. So number 1, brushing twice a day for 2 minutes. Number 2, using something between your teeth every day. And number 3, making sure that your toothpaste has some fluoride in it. Now, nothing can replace professional dental cleaning of your teeth, so I would recommend that once you are out of the isolation period that you get to see your dental professional as soon as you can, so that you can have a checkup and a clean to make sure that everything's nice and healthy. But until then, please stay home, stay safe and follow the government guidelines, and hopefully we'll be seeing you in the clinic very soon.